Hello guys, welcome to my YouTube channel Indian Doctor Strange. In this video, we are going to see about a disease called Meniere's disease. It is a concise presentation for medical students. Okay, what is Meniere's disease? It is a disorder of the inner ear. The endolymphatic system is distended with endolymph in this disease. The endolymph is actually secreted by stria vascularis, which fills the membranous labyrinth absorbed through the endolymphatic sac. The exact cause is not yet known for this disease. What is the pathology of this disease? The distension of endolymphatic system due to increased volume of endolymph occurs, and the cochlea dilates and completely fills the scala vestibuli with the mouth bulging of resinous membrane. What is the etiology of this disease? Can be due to increased production of endolymph or its decreased absorption. Either can produce this disease. Some of the causes like defective absorption by endolymphatic sac, food or inhalant allergy, autoimmune process, viral infection especially by herpes family, stress, vasomotor disturbances, the sodium and water retention, and condition like hypothyroidism. What are the clinical features of this condition? There are four main symptoms of this disease. They are episodic vertigo, fluctuating hearing loss, tinnitus, and oral fullness. The episodic vertigo is sudden in onset. The fluctuating hearing loss will be low frequency first, and in course of the time the higher frequencies will also be affected. In tinnitus, low pitch and roaring type. Sense of fullness or pressure in the ear will also be present. These are the four cardinal symptoms of this condition. Okay, examination. First, tuning fork test. In this, first we are doing Rini test. It is positive. Weber test. It is lateralized to the better ear, and ABC absolute bone condition reduced in the affected ear. Nystagmus will also be present in this condition. Investigations. First, pure tone audiometry. Rising type curve will be seen. In speech audiometry, discrimination score is less. Electrocochleography SP by AP ratio will be more than 30%. In caloric test, the reduced response on the affected ear. Glycerol test, improvement in audiogram after intake of glycerol. Certain special audiometry tests can also be performed. Treatment. As a general measure, first we have to give reassurance to the patient, stop smoking, decreased salt intake. These are the advice we have to give. Reduced intake of coffee, avoid stress. Okay, avoid bad activities. And the treatment of acute attack. First, reassurance, bed rest, and vestibular sedatives like dimenhydrinate, promethazine, thioclate, prochlorphenazine, diazepam, atropine, etc. can be given intramuscularly or intravenously. The vasodilators can also be given, which is inhalational carbogen, histamine drip. Okay, now we are going to see about the treatment for chronic phase of this disease. The vestibular sedatives like prochlorphenazine, vasodilators, beta-histine, nicotinic acid, diuretics, furosemide, propanthyline bromide. Avoid allergens if he or she is allergic to some of the allergens. Correction of hypothyroidism is given if there is a hypothyroidism is present. Intratympanic gentamicin therapy can also be given, which is called chemical labyrinthectomy. The gentamicin destroys the labyrinth system of the ear, and which improves the hearing. It improves the symptoms. Next, we are going to see about the surgical management. First, conservative procedures. Cochlear component is preserved, such as decompression of endolymphatic sac, endolymphatic shunt operation, sacculotomy, section of vestibular nerve, ultrasonic destruction of vestibular labyrinth, and some of the destructive procedures which destroys the vestibular function of the ear, which helps in improvement of the symptoms. The intermittent low pressure pulse therapy can be given. It is also called Meniere device therapy. These are some of the points about the Meniere's disease we have to know. Okay, thank you.